trying it for the first time.
What are you doing today, sir?
One of my great pleasures each year to attend events like this where we come together really as a community of learners, educators, scholars, leaders, and servants to celebrate the successes in our communities, both here at the university and in our broader communities. As Sister Nancy suggested, the College of Professional Sciences is proud to support 11 different departments and schools, 4 different centers, and a Montessori lab school. We confer undergraduate and graduate degrees and licensure credentials in the fields of education, social sciences, the health sciences, as well as leadership. And we currently support over 1,500 undergraduate and 1,300 graduate students. We have about 70% of all graduate students on campus are in the College of Professional Sciences. We thrive really through the efforts and commitment and dedication of over 150 full-time faculty and staff members. But we're gathered here today to recognize and honor the role that our community plays in educating our students. We wouldn't be successful without literally the hundreds of preceptors, practicum and internship supervisors in schools, in health networks, and in social service centers around the Cincinnati area as well as the country. And so on behalf of the college, I want to extend my gratitude to any of you who might be serving in that capacity. The Department of Health Services Administration, which I'm sure Sister Nancy will mention, is celebrating its 58th year graduating healthcare leaders in their MHSA program. You might not be aware that they recently launched BSHSA, a Bachelor's of Science in Health Services Administration, which is one of the fastest growing undergraduate programs here at the university and prepares young women and men for careers in health informatics, finance, marketing, and planning. Currently enjoys a 100% job placement rate within 90 days of graduation, so a very successful undergraduate program. It's also a very exciting time in the HSA department. They have 2 active faculty searches, which we're very excited about. They have a new and growing graduate program in health economics and clinical outcomes research, which we're looking at synergies between that and the MHSA program. And they also are participating in an upcoming grant proposal that we're going to submit with one of our large healthcare networks here in the city. The department itself is perfectly aligned with the emerging strategic plan of the college, which is to become a recognized leader in population health and wellness through interprofessional collaboration and education across all of our portfolio within the college. So we're very pleased to support the department and to be a part of this event. And on behalf of the college, again, I just want to welcome you and wish you enjoyment in this program. Thank you.
From the class of 1979. You don't have to be an alum to win this award, but Mr. Susi just happens to be an alum, and that's just one more sign of him giving back throughout his career. He's the president of Indian River Medical Center in Vero Beach, Florida. Now, I understand that this locale was affected recently by Hurricane Matthew, but their winds were only 75 miles per hour, half of what was predicted. So Jeff navigated a very successful experience through that nature explosion. So Jeff has precepted 5 Xavier residents since 2000. Anthony Houston in 2000, John Mendez and Greg Coleman in 2006, Damian Colty in 2014, and Caitlin Hall this past year, 2015-2016. So 3 of those residents from the past are here, and they've all come from a distance, so we could call them the Magi. They traveled a distance to come here. We have Tony Houston from Hot Springs, Arkansas. We have John Mendez who's in Orlando now, but he had been in Cincinnati, so he's moving back and forth. And we have Caitlin Hall, who is in Vero Beach. So what a nice tribute of the three of you to come and be with Jeff. Now it's my pleasure to turn over the microphone to Tony Houston, class of 2000, who will introduce our awardee. And Tony currently is the CEO of CHI St. Vincent in Hot Springs, Arkansas. So please welcome Tony Houston.
Wow, it's great to be with you all. I have to say just a couple things before I go to my prepared remarks. It'll be about 5 minutes, so bear with me. Your appetizer before we get the main course, and I can't wait to hear Jeff. So a couple things, sister. I can tell you're still training the students well. They look great in their uniforms. We have our name tags on the right-hand side so that when we shake, yeah, is that how we're taught still? Isn't that great? Yeah, we keep passing it on. So that's really good to see. Some familiar names out there. So Tom and Dr. Guo and Karen and Bill taught me, and I have to say, Bill, again, not part of my prepared remarks, but there's a quote you gave us in law class. You said, pigs get fat and hogs get slaughtered. Y'all know that? I use it still today. It's actually a really good one when you talk to doctors, especially. So remember that. Remember that. So again, it's a real pleasure to be here, and I also had a chance to, out on this beautiful veranda here, got to meet some students. So I got to see Taylor and Dustin and Lauren and Sean. So good to meet you. And Bishop Burton is the brother of a resident that I had a privilege to precept, Bradley, who is out at Stanford doing great work. So again, pleasure to be here. We celebrate Jeff Susi today, and I'm going to spend a little bit of time telling you a little bit about him, but also sharing with you my experience as his first resident down in Florida. So first and foremost, Jeff is a great husband. Roseanne is here with him. He's a fantastic father and a grandfather and a tremendous mentor and friend. And so we'll share a little bit about that. He's touched many lives, and he's going to share with you, I think, some inspiration, because he certainly inspired me. Jeff grew up in upstate New York. He grew up in the area where we enshrine and celebrate heroes of baseball. So those of you who are very excited, Barry, about your team who won last night, maybe some of those will find their way to Cooperstown as well. And so we celebrate in a different way one of our healthcare heroes, Jeff. And so sort of like enshrining you when you grew up near Cooperstown. So Jeff received his Bachelor's of Science in Physical Therapy from Ithaca College, so he is a clinician and always core to his roots, knows what it's like to work at the bedside. He then went to Xavier after 3 years of practice, and so he was also selected as the president of his class, and that was during the Arlinghouse years, so you had to have your stuff together to be the president, and so he started early and is a fantastic leader. From there, went and did his residency in upstate New York, Albany Medical Center, went over to Rochester, did some amazing things in a very progressive time, and maybe Jeff will share a little bit about that. Off to Ann Arbor to work in Catholic healthcare, down to Miami to do some specialty hospital work, and then his first major role as a CEO in the Temple healthcare system in Philadelphia prior to coming to Indian River 18 years ago. So I got to go and meet Jeff in 1999, my very first phone interview. So all of you maybe have had this opportunity to do, I know we spend some time with the classes and the students to do face-to-face interviewing and prepping them. I don't know how much time we prep them to do phone interviews. So it was the first time I ever did anything like that. Before I went down and did my face-to-face, I was a little nervous, and it was the first opportunity for me to really sense Jeff's zen-like calmness. He does have it, and I'm going to share with you some of that. So I thank you for calming me down as a young student on the phone. So it was great to ultimately be, if you will, awarded an opportunity to work with Jeff as his resident down in Vero Beach. As I mentioned, his beautiful wife, Roseanne, is here. They are an amazing couple. Jeff has 4 children. Brian, his oldest, is actually a cardiologist. He served in the Navy, so one of our heroes, and is now practicing in New Jersey as a cardiologist. He's married to a neurosurgeon, and they have 2 children. His next is Angie, who's a NICU nurse in Colorado, and she has 2 kiddos as well. Matthew is at the University of Miami in Florida, getting ready to graduate and head off to make a difference in the world. And their youngest is Erica, who is a collegiate athlete at the University of Virginia, where she plays tennis. And so Roseanne's on the way to go see her compete at Chapel Hill after we finish here, so we'll be thinking of Erica. So many of you probably, hopefully, when you thought about coming to a graduate program, Xavier, a big difference, as Sister said, is our residency program. And again, my first choice was to go to a place that had an alum. I was looking for a residency in a community hospital, but more importantly, to try to go somewhere that had a Xavier alum, so I was lucky enough to find time with Jeff. So I mentioned to you his Zen-like aura, and so the first time I started, it was early prior to my residency. Again, we started in January then, so I landed on the ground in Vero with my fiance at the time, Rebecca, and the first thing we did is Jeff said, we're going to go work at the hospital on New Year's Eve. And so some of you who are students, you may not appreciate this, but back then we thought the apocalypse was on us. It was Y2K. And so we were going to party like it's 1999 in the cafeteria of the hospital. Yeah, my wife is a big Prince fan. That was not on her list of the 1999 party. Nonetheless, I got to see how Jeff was able to mix what at the time was a pretty interesting potential to have some difficulties, so we were prepared, but also made it a lot of fun, and I'll never ever forget it. And so Jeff taught me even there how you can have grace in when you're facing of something of the unknown, but also being of a community. So that's how we started off. My residency was amazing. Jeff gave me opportunities to obviously spend time with board members, to be a part of committees, to take trips about looking at EMRs and meeting with developers and space planners and architects, also to spend time with people from the advisory board and Premier. I had a chance to spend a week at a large hospital in Orlando. Jeff just gave me a tremendous amount of opportunity. He also gave me a chance to really have a sneak peek into some interesting times. So when we were there, Jeff got there in '98, I got there in 2000, and the nursing team the nurses had brought in a union, but we hadn't a contract yet. So when I got there, we were just getting into contract negotiations, and I remember we had our attorneys helping us, and our HR team, and our finance team, and so we were in Jeff's office one late afternoon, early evening, and the finance team and the HR team had some spreadsheets, and we're talking about what we could afford, what we couldn't afford, and our tact to go into negotiations. And Jeff has this way about him where he allows space in the room. He's not the first one to speak. And so lots of folks gave their input, and we were talking a lot of numbers. And then Jeff was just listening. And all of a sudden, he comes out and he starts breaking down the numbers. He's able, almost like Rain Man, to get the numbers right. Right, Katie and John, you know what I'm talking about? It's amazing, isn't it? It's one of the first things I remember that I was like, I need to learn how to do that. But Jeff can do math really quickly in his head. And it was impactful for me, but again, showed you how he trusted a young person to be at the table doing that. So I thank him for it. Also, a couple other things I want to talk to you about that inspired me about Jeff, and then I'm going to turn it over to him. So some takeaways. Jeff always said this to me, and I think he says it, and I know he practices it. Be transparent. There are no secrets, so whatever you do in life, be prepared for it to be on the front page of the paper. That's an important lesson to take away, for sure. He remembers names. Again, he started as a clinician, so it's an amazing thing that he does. So he could shake a hand and remember a name. And again, I practice that each and every day. When I became the president in Hot Springs, I asked our HR team to print for me the badges and the names so I can learn people. And I know Jeff does it too. It's a big deal. So when you go out and about, concentrate. Remember people's names. They'll remember you, right? Because they'll see you in the community, they'll see you in church, and they'll know who you are. You need to remember who they are, and I learned that from Jeff. He also told me, don't give the slow no. So in our positions, people will ask you, I think can we do this? Can we buy this piece of equipment? And you know the answer is no. Don't say, we'll think about it. We'll have a meeting. We'll talk to the committee. Be transparent, and don't give a slow no. He also told me, don't drive a car fancier than the chief of staff. That's important. Jeff, when I was there, you had a Mercury. It was a Mercury. It was like an old cop car.
Traded that last month.
Oh, last month. I have a Buick, Jeff, so I pay attention to that. Never have a fancier car than your chief of staff. Don't do it. Jeff also told me, don't come into the same way in the hospital every time. Change it up. Go in where people come in. So go in by the dock. Go in where the coworkers are. You'd be surprised at how you can interact with folks. And so he also said, don't be predictable as your rounds. So round on the weekends, round in the evenings. Spend time with the people. And so I think about that every day, and it came from Jeff. Another thing he told me, it's a lot easier to say no than it is to say yes. I had to think about that one for a second. And as a young person, I'm not sure I fully appreciate it. In my role today, you have no idea how much I appreciate that. So when you have positions, CEO and president, a lot of people look for you to make a decision. And it's easy to say no. Right? You don't have to really think about it. You don't have to look at data. You can say no. It's a lot harder to say yes because you have to be inquisitive. You have to dig deeper. And I'll never forget that, Jeff. And I use it each and every day. So again, back to that zen-ness. Another thing I took from Jeff, as he's able to listen, he always say to me, does it need to be said? Does it need to be said now? And does it need to be said by me? So that really sits with me about, when you listen and think, again, being in roles of leadership, it's okay sometimes to let things pass. You don't always have to make the decision right away. And it's okay if someone else maybe makes the decision. So I think about that. And then lastly, in closing, I'll give you this one that has stuck with me more than any of them. I'll never forget it. Again, we were working late. And at the time, Jeff's kiddos were pretty young. And he told me, he said, you need to go home. You need to take care of Rebecca. You need to spend time with each other. He said, one day you're going to leave here. And we'll probably throw you a party, which we did, and it was a really good party, by the way. And we may give you a gift, and I have it in my office still today. It's a picture of the hospital. Lots of people signed it. Goodwill wishes. He said, I doubt we'll name a wing after you. We probably won't put a statue out there with your bust unless you write a check. And so we're going to forget you eventually, right? But your family will never forget that you missed a dance recital or potentially an anniversary or some other grand occasion. So I learned from you, Jeff, how to balance your life and how important it is to not only be a great leader and be there for your team, but to always be there for your family. And so I know I'm not one of the kids, but as your first resident, I certainly feel like I'm an extension of that family, so I thank you. We celebrate a true treasure of this program. We celebrate Roseanne's husband. We celebrate Brian, Angie, Matthew, and Erica's dad. And we celebrate a great mentor and friend. So ladies and gentlemen, I give to you our 2016 awardee, Mr. Jeff Susi.
Tony, thank you so much. What a wonderful and warm and sincere introduction. Wasn't that great? Super. Thank you, Tony. Before Jeff offers some remarks, let me just share with you the gifts that we have for him. The first, and this is a large plaque that students see all the time when they walk into the department. It's hanging right in the corridor, and it looks like this. Looks familiar, right? Well, Jeff, you are in this box right there. So this will be always hanging there. And we also have another more personal gift for you that you can open later if you wish. So there you are.
Thank you.
So as Jeff comes to the podium, he said he would be happy to take any questions that you might have for him. So please welcome and congratulate Jeff Susi.
Well, the first difference you'll notice between resident and preceptor is paper versus iPad. And I thought for sure when you were talking Rain Man, you were going to say, I'm a good driver.
Yeah.
I'm a good driver. Yeah. But thank you for those remarks. I wish I remembered half of the things I taught you. It's hard to put into words how pleased I am and honored to accept this award. And I asked Sister Nancy for some of the names of previous preceptors because I knew I would know some of them. I was so impressed and humbled by the list. I mean, people that, Mark, you and I will remember, Jim Moss, Stuart Laird, James Fitzgerald, Bill Copeland, Al Zamberlin, who I knew in Ann Arbor when he was running the VA, and Jerry Vasile, who I worked with when he was the head of Strong in Rochester and I was in the community. These are people that I consider legends, and so it is really humbling to be put in the same list. And one other, Dick Quinlan, out of Massachusetts. I didn't know Dick when he was a hospital administrator. He's an auxiliary at our hospital. He's retired, and now he spends his time taking care of patients with no pomp and circumstance. He's got his white shirt on as an auxiliary and enjoys transporting patients. But that's the kind of person many of our preceptors have been. And I've talked to Dick, and he did share with me, he says one of the most rewarding things you can do in your healthcare career is mentor others and see them develop and continue those relationships, and I totally agree with him. I have two messages for residents and future residents. The residency experience is a two-way street. And in the very beginning, I think you all know, at least with me, we don't expect much in the first few months. It's a one-way street of get out, get experience, go any place you want, interact with department heads, other vice presidents. But then it transitions back to payback. And we do expect something from you. And I will tell you, the more you pay back, the better the residency is for you. So find things to do, get involved in them. You are the ones driving the residency experience. Your growth and development is dependent upon you. You can drive it as hard as you can. It's rare that you get the kind of experience you do in a residency where you really have a license to go anywhere, ask anything, get your fingers into anything, and put your fingerprints on anything. It's a wonderful experience, and I encourage you to pursue that with 100% or more. I also believe you can't be a good preceptor without a good resident. I think you can be a good resident without a good preceptor because you can always find a way to make it work. So really, it'd be an honor today. It's an honor to all of you that had a chance to come to a residency with us that you made me a good preceptor. So I want to thank you. And by the way, throughout the rest of your careers, you can't be a good mentor without a good mentee. Same thing applies. So you can be a good mentee and always seek out those opportunities. Second message, as leaders, you will impact people and their lives more than you will ever know. And many times you don't have any feedback. So take your roles as leaders very seriously. I'm going to give you two examples that I was lucky to connect years later and find out, one, how someone impacted me, and the other is how I impacted someone else. So I practiced physical therapy for 3 years. I took my search for a graduate school program and a career very seriously. So I talked to a lot of people, made some phone calls, and decided that I wanted a residency program because of its importance. So I really appreciate that this becomes a fundamental part of this program. And I came to Xavier. Fast forward 20 years, I was in Indian River Medical Center, and a hospital CEO comes up to me at a national meeting, and he says, "You don't know me, but I used to be a VP at Indian River Medical Center. And I've always been fond of that hospital. I followed what's going on in the community. It sounds like you've been there now just two years and you're doing a great job." And I said, "Well, actually, I talked with you 20 years ago. I was doing physical therapy and I worked with your sister Mary, speech therapist. And I was looking into hospital administration. She said, 'Talk to my brother. He'll tell you what it's like. He's down in Florida.'" So I called him up. We had a great conversation, probably 30 minutes, and he steered me towards the residency program and towards programs like Xavier, and he had a profound impact on my life. But he never knew it until 20 years later when I could say, "Thanks, Bill. Your guidance really shaped my career, and I'm here today because of you." He had no idea. Another quick story. In 1989, I was moving to Miami, put some stuff in storage, and then I had to get the U-Haul to get stuff out of storage. So as I walked into U-Haul, there were two clerks. One guy was waiting on 3 people, and the other one was waiting on me. I got the guy who was slower than molasses. The other guy was bilingual. He was processing everything. He was just really, really good at his job. So I went back maybe 2 days later to return the U-Haul. And the guy who I was very impressed with was there. Nobody else was there, so I got a chance to talk to him. And I said to him, "You know, have you ever thought of a job maybe in healthcare as opposed to working for U-Haul. You would be great at a reception desk and your people skills are outstanding. So I gave him my card, and fast forward, a month later he got a job at our hospital. I was really pleased that I had done something for somebody that I thought was a good career move. So we're going to fast forward again. When I accepted my job at Indian River Medical Center, this is now 8 years later, I get this letter in the mail. And the letter says, "I'm sure you don't remember me. I used to work at U-Haul, and you recommended that I pursue a job in healthcare at the registration desk, which was great. I loved it so much that I continued my degree, got my graduate degree, and now I'm vice president and named a big hospital in Miami." Whoever would have thought that kind of interaction for 15 minutes can have such a profound effect on someone else? And you probably have already done that with high school students, grade school students, other people you impact. But as your careers develop, you will have many opportunities to do that, and you'll rarely know the results of it, but just keep doing it because you impact people as leaders. So my message is, you never know when you're going to impact others, but always do the right thing. And you are the drivers of your experience, and your careers today and every day will be dependent upon that. Again, I can't thank you enough for this great honor, and I wish you all the best in life. And now, if you want to take a few minutes on any topics, fair game. I'll be glad to talk about anything from Michigan football to Cubs. And by the way, Hurricane Matthew was only 75 miles an hour wind. 2004, we had a record. We had 2 hurricanes in 1 month. September 2004, well, first Francis and then Jean passed over Vero Beach, the eye of the storm. It really is calm in the middle of the eye. You walk outside and you look up and it's a blue sky, and then you got about 3 minutes and you're back up to 100-mile-an-hour winds. Those storms both gave us 115 and 125-mile-an-hour winds. But like anything else, when you have the right team, they hold the organization together, and patient care always comes first, and we've gone through those storms, and I'm always very, very proud of the team that we have at Indian River. Anybody have any questions? By the way, I will tell you one other thing. This may be a surprise, but actually people like Mark Hanahan and I predate DRGs. Can you imagine that? Mark, I want to be in good company, so I wanted to mention that. Mark is a classmate. We had a good class. Any thoughts or questions? If not, I'll just end with thanking you, and I'll be around for a while too if you want to talk. Thanks again. It's a wonderful honor.
Jeff, thank you for your very wise and interesting comments. We appreciate that, and it's great advice for our students. So congratulations again. Couldn't think of a better person to get our Preceptor Award this year. How about one more applause for Jeff? You know, in the Gospel of Luke, we read, when one has been given much, much is expected. And Jeff, you are living proof that that's the way to go. So, thank you very much. It's been a great time together. We appreciate all of your attendance. Students, you get to go on to a brief afterglow event. Where's Miss Tina? The room next door, okay, room 2 doors down. Students will gather down there with alumnus Mr. Barry Sasavsky, who will provide our afterglow. So, everyone, thank you so much, and it's been another great day for Xavier MHSA. Have a blessed day. Thank you.